Imagine this. Imagine you're living in a small rural village in the middle of nowhere. There's no running water, no electricity, no paved road. The one dirt road is rutted and washed out part of the year, and it's about a 2-hour walk to the nearest bus stop. Now, there's a health clinic in your village. You're very lucky. But the nursing assistant who works there is often out serving other communities in the surrounding area. And you have a sick baby with a high fever. The nearest pharmacy is 20 kilometers away. Now, you might be able to get a warm Coke for all the good it'll do you, but can you get medicine? So, malaria is a major killer around the world, especially in Africa. In 2010, 660,000 people were estimated to have died from malaria, 90% of them in Africa, most of them children under the age of 5. Now, malaria doesn't have a vaccine yet, but there are effective treatments if you can get to them. Measles, well, there's a vaccine for that. And over the last few decades, we've seen measles rates come down 74%, but it still claims 450 lives every day, most of them children under 5. Smallpox, one time a major scourge, has been eradicated thanks to global immunization efforts. And we can do that with other diseases if we can get the vaccines and medicines to the people who need them. So how do we do that? Well, Bill Gates said in a recent interview with the Washington Post, and by the way, Bill Gates, we all know, is probably one of the most successful businessmen that a capitalist society has ever produced, right? So he said this, and I'm going to quote him correctly. Capitalism did not eradicate smallpox. It doesn't know how. Polio eradication is a work in progress, but it's not being done by markets. It's being done through foreign assistance, through aid. Now, on the other hand, Melinda Gates and others have asked very pertinent questions about the seeming ubiquity of Coca-Cola and their products around the world, in the farthest flung places around the world. And she said this at a 2010 TED Talk. Again, I want to quote her correctly. We're trying to deliver condoms to people or vaccinations. How is it that they can get Coke to these far-flung places? If they could do that, why can't governments and NGOs do the same thing with vaccines and medicines to treat HIV, malaria, TB? Well, I offer 2 reasons why that's difficult. Money and logistics. The Coca-Cola supply chain is profit-driven, all right? It's the commercial model. Every step along the supply chain, from the raw materials to the manufacturing, to the bottlers, to the distributors, to the retail outlet. Somebody makes a profit. Every time a bottle or a case exchanges hands, somebody makes money. Now, there's a crucial fact here, though, that the last mile, or in a lot of places, the far-flung places, the last 20 kilometers, that's the hardest part in many places. It's the most risky part. It's the most expensive part. And it's the part that Coca-Cola is not paying for. Because what happens is this shopkeeper gets on his bike, pedals in 20 kilometers down that rutted, washed-out road to the town that has the distribution point, loads up a couple of cases on his bike, pays for it then and there, turns around and pedals back to his village. And if he takes a tumble on that journey and shatters his inventory, the loss is his alone. Now, with supply chains for medicines, there's a lot of similarities in the last mile. It's still tough, it's still rough, and it's still often 20 or 30 or 50 kilometers away. Now, a lot of places like Mwanawina in western Zambia, a small rural village, they have to use ox carts during the rainy season because their road is washed out. All right? And there's some key differences with the soda supply chain. First of all, nobody in that village is paying for vaccines. They're free. because we want to encourage families to vaccinate their children, and because those villages are very impoverished. There's not a whole lot of loose money hanging around, and we don't want poverty to be a barrier to health. Now, of course it is, but we try to remove as many of those as possible. The same thing is true with many medicines to treat HIV, to treat TB, to treat malaria. We want to interrupt the infection cycle. So nobody's paying for that, but there's some other key differences. Everybody loves a cold Coke, right? You don't want to drink a warm Coke, but you could, and it would still quench your thirst. Vaccines and a few other medicines have to be cold, otherwise they lose their efficacy and their potency. They must be cold even when there's no electricity. They must be administered by a trained healthcare provider. You don't need that for Coke, right? So there's a lot of differences between these two supply chains. And nobody in that village is earning a profit. There's no short-term return on investment in that supply chain. Public health supply chains are mission-driven. The only profit is very long-term. It's in the health and well-being of those people. That's not a model that Wall Street deals with very well. But I will say that we are learning a lot from commercial supply chains. Things are getting better. We're seeing real improvements on the availability of medicines and vaccines, and therefore real reductions in preventable deaths from vaccine-preventable diseases, from TB, from malaria, from HIV. We're seeing real progress. And here's just a small bit of evidence in this. In one African country, we took a look at and we compared the availability of 4 different presentations, different dosage types of the most effective malaria treatment with the availability of 3 types of soda provided by a certain soda manufacturer. We looked at 200 clinics, the availability of the medicines, and the surrounding shops, the availability of the sodas. And guess what we found? A higher percentage of clinics had at least 1 dosage type of that malaria medicine available than the surrounding clinics had at least 1 type of soda from that manufacturer. So we are seeing real progress, but it's not cheap. So who pays for this? If the villagers aren't able to pay either the whole price or part of the price, then who pays? Who pays to get these vaccines and medicines to those villages? Well, we do. American taxpayers are major funders of these sorts of programs, of procurement and distribution of vaccines and medicines to treat many different diseases. Also contraceptives for family planning programs. And by the way, taxpayers in Great Britain, Germany, France, Australia, New Zealand, Norway, you name it, are also contributing to this effort. So are taxpayers in Zambia and many other developed countries. But it's not enough money. It never is, because the need is very, very large. And so I want to offer a couple little thoughts here about this. The American taxpayer, we do contribute a lot, but we actually are only spending 1/3 of 1% of the federal budget. 1/3 of 1% of the federal budget on all global health programs, of which commodities, medicines, are only a fraction. In fact, total spending on foreign affairs, diplomacy, foreign assistance, the UN, all that sort of stuff represents just 1% of the federal budget. That's about $28 billion, not chicken feed, but to put that in perspective, we American consumers spend about that much every year on vitamins. So why do we do this? Why are we spending billions of dollars like this? Even though it's not enough, we still are, we're still spending significant amounts. Why? Well, here's one reason. This is Joseph, a before and after picture. He's HIV positive, and thanks to us, he has access to antiretroviral therapy to treat his HIV and keep him healthy. He and millions of people like him are now healthy members of their community, able to support their families, contribute to the stability of their communities. Now that's the feel-good reason. There are also people who would say, look, That's all fine and dandy, but we've got problems here in America. Let's focus on that, and the rest of the world can get along without us. Well, for them, I offer a second reason. This is a map of daily airline traffic around the world. In 48 hours, you can get from Wanawina, or pretty much anywhere else in the world, to right here. Infectious diseases know no boundaries. They don't respect borders. And what happens in these far-flung places can affect us, can infect us here in the United States. It happens all the time. So, next time you hear somebody complaining about wasting taxpayer money on foreign assistance, take a moment and reflect what you're investing in. Next time you're doing your taxes, filing your taxes, that's coming up, think about where a little bit of that money's going to. Next time you buy a Coke or a Pepsi or fill a prescription, consider how fortunate we are. Because we, writ large, are all connected one way or another. And what happens in Wanawina doesn't stay in Wanawina. Thank you.